On the new agent ibrutinib in patients with chronic lymphocytic leukemia.
Good morning. On behalf of the patients who participated in this study, my fellow investigators, it's a pleasure to present this data at this press conference. So, chronic lymphocytic leukemia or small lymphocytic lymphoma, the same disease, these patients who have had a short response to first-line therapy, who have deletion 17p, or who are elderly, have very few treatment options that induce durable remissions. Identifying new therapies in this patient population, particularly those that extend survival, is very important. Ibrutinib is a first-in-class irreversible inhibitor of Bruton's tyrosine kinase and has been pursued in phase 1 and phase 2 studies in this disease where promising results have been observed. Based upon this, a randomized phase 3 study comparing ibrutinib to a standard comparator approved for CLL, ofatumumab, was performed. So let's talk a little bit about the study design as depicted here. This is a phase 3 study that compared 1-to-1 oral ibrutinib, which was taken once a day until progression or unacceptable toxicity, versus ofatumumab administered IV using the package insert as improved for relapse and refractory CLL. The stratification of the study at the time of enrollment was based upon being refractory to purine analog-based chemoimmunotherapy, and that was defined by a response of less than 12 months, or the presence of deletion 17p, a very adverse risk factor for this disease. At the time of the analysis that's being presented, the median follow-up was 9.4 months, and something that I will emphasize is, as we look at the survival, is that in the middle of the study, there was a crossover after the first 57 patients were enrolled to allow patients who had progressed to receive ibrutinib based upon the very promising and durable remissions seen in the phase 2 study. So this picture's worth 1,000 words, and this shows the progression-free survival of ibrutinib, shown in gray, versus ofatumumab. At 6 months, the progression-free survival on ibrutinib was 88%, whereas with ofatumumab it was 65%. This was highly significant with a hazard ratio of 0.215. Say this equated to a reduction in progression or death by more than 78%. And importantly, when we look at all the different genetic groups for CLL, the 17Ps, the refractory, the elderly, every pre-treatment or adverse prognostic factor that was looked at, ibrutinib was favored. A big concern with ibrutinib has been, does it enhance the progression to Richter's? And this is the value of a randomized phase 3 study where we saw the frequency of Richter's was similar between the two arms, two in each arm. This looks at this overall survival. And again, we see that despite a crossover that was allowed after the first 57 patients, ibrutinib significantly prolongs overall survival with a 57% reduction in the risk of death in the ibrutinib arm as compared to ofatumumab. And I'd highlight that you see right here the plateau of ofatumumab appears to plateau, and this is at the 9-month time period where ibrutinib crossover was allowed. The safety of these two agents, both the comparator and ibrutinib, were both acceptable. We saw a similar frequency of major hemorrhages. Atrial fibrillation was more common with ibrutinib, and neuropathy with ofatumumab, emphasizing that phase 3 studies can point out new toxicities with each agent when compared to something else. Renal toxicity was similar between the two arms. So in conclusion, ibrutinib significantly improves progression-free survival, overall survival, response as compared to ofatumumab. The impact of ibrutinib in response, overall survival, and progression-free survival was similar irrespective of the pretreatment features or molecular features of the disease. This impact on survival was still noted despite a crossover that was allowed after the first 57 patients had progressed. The toxicities in each arm were manageable, particularly with ibrutinib, and patients, at this time point, 86.4% of patients are still receiving ibrutinib on this treatment. And this is a very important study because for the very first time, it shows ibrutinib beats a standard comparator that's approved for the use of relapse and refractory CLL. Thank you.